Hi everyone, welcome to Imaging Study. Today we are going to see a case of paraumbilical abscess. A middle-aged female patient came with painful swelling lateral to the umbilicus. She also complained for fever for 3 days. Let's see what we have got on ultrasound. Here you can see the ultrasound image of the paraumbilical swelling. You can see a complex area with thick margin and internal debri. You also can see adjacent distortion of the subcutaneous fat layer. When we put the color Doppler, you can see only the peripheral flow. No vascularity is noted inside the mass. These features indicate it as an abscess. There was no intraperitoneal communication. The mass is confined within the subcutaneous layer. Here is the picture of the thick-walled irregular complex mass with the internal hazy component and surrounding irregular fat distortion indicating paraumbilical abscess. So in summary, an irregular thick-walled complex area with internal debri and surrounding fat stranding is noted within the subcutaneous layer of paraumbilical region. Color Doppler shows no internal vascularity, only the peripheral flow is seen. So the diagnosis is paraumbilical abscess. Now the take-home message. In any superficial abdominal abscess, don't forget to check intra-abdominal or intraperitoneal communication. Thank you for watching this video. Subscribe to our YouTube channel for more. See you on the next one. Have a nice day.